Let's start with what exactly are AVMs?
So, AVM is a malformation of the vessels of the brain. So you have typically have an artery that brings blood, and then you have a capillary network of small vessels, and then you have a vein. In AVM, all this amazing interaction of vessels, architecture, is disrupted. And so, as a consequence, you have an artery that just brings high-pressure blood straight into the vein. And as a consequence, there's high risk of this rupturing and bursting inside the brain, causing horrible consequences for the patient.
Using your image, can you explain to us what causes this?
So most of them are congenital. If you can have the first slide. Most of them are congenital. People are born with them. Unfortunately, sometimes it's difficult to, sometimes it's easy to find them, but sometimes it's difficult to find them. In this case, that's what happens is a CAT scan. What happens when these high pressure vessels burst, then you have tremendous amount of blood rushing into the brain, and that could be deadly. Actually, at times it is. This is a disease that's very difficult to treat until now, when we have these amazing techniques that we can use nowadays, and now the mortality and disability for this disease has decreased tremendously, like with restore stroke, and we can discuss them. So in the next slides, I can show you there's different types of the way vascular malformation are designed.
Okay.
So they are of different types. We really won't go into many details, but the one that we want to concentrate the most, which is the most common, is the typical AVM. So you have an artery that brings blood to a set of malformed vessels. So these vessels are the same fish that they have the arteries in the fetus. So they are used to very low pressure system. But then, of course, as we grow up and we grow older, our pressure goes up. So these vessels cannot possibly sustain this tremendous pressure.
It's too much. It's at high pressure is too much.
Exactly. So it's like, and then of course they burst. It's like basically a bomb